Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Today we are talking about kidney health. Having a chronic disease like kidney disease can be very difficult. The treatment is long-term and the symptoms can be frustrating. But the important thing for you to know is that you don't have to manage it alone. Help is available. Our guest today is Dr. Fawad Qureshi. He is an interventional nephrologist at Mayo Clinic Health System. Dr. Qureshi, thanks for joining us today.
You're welcome.
Well, let's start out by talking about why is it important to talk about kidney disease and kidney failure?
Absolutely, Jason. I think it's very important to talk about chronic kidney disease and kidney disease in general because it's the 8th leading cause of death in the United States of America, and 31 million people have it. And the worst thing is that 9 out of 10 people who have chronic kidney disease don't even know that they have chronic kidney disease. So imagine only 1 in 10 people who have chronic kidney disease actually know about it. So that's why it's important to talk about it and know about it.
Seems like it's much more common than probably a lot of people think then, really.
Absolutely, it is.
Well, let's start out by telling folks exactly what the kidneys are and what they do in the body.
Absolutely. Kidneys are 2 bean-shaped organs which are located in the back of your abdomen. They have a lot of important function, including filtering waste and excess fluids, managing and balancing your chemicals in the blood, converting vitamin D into an active form so that they can keep your bones healthy, releasing and making a hormone which makes blood, controlling your blood pressure, getting rid of toxins and medications.
They're busy organs then, aren't they?
They're very busy organs.
Yeah.
And the good thing is that the dumbest kidneys are supposed to be smarter than the smartest person.
Well, what are some causes of kidney disease?
The most common cause of kidney disease in the United States is diabetes, and the second one is hypertension. But other diseases such as high cholesterol levels, genetic predisposition, all of these things can cause chronic kidney disease also. In older individuals, especially men, or urinary obstruction, certain medication use, all of them can cause kidney damage. Certain procedures like vascular procedures, cardiac angiograms, angioplasties, all of these also damage the kidneys on a chronic basis.
So what are the symptoms of kidney disease?
That's a very tricky question, Jason. Unfortunately or fortunately, that when the kidney disease happens, the kidney function has to decline to approximately 20% before you will have any kidney symptoms. The good thing about this is that you can donate one of your kidneys without having any symptoms or any problems in your body. And the bad thing is that you will not know that you have chronic kidney disease until the end. And when you have symptoms of chronic kidney disease, it's usually already too late. The most common symptoms of chronic kidney disease, unfortunately, are also very vague, which can happen in any other disease, such as fatigue, nausea, vomiting, poor appetite, generalized weakness, changes in sleep patterns, some generalized itchiness, some weight loss, some anemia, all vague symptoms which can happen in any other medical disease.
So just so I'm clear, you said that once the kidneys are to 20% function or less, generally that's when symptoms show up.
Yes.
That seems like it would be kind of almost a little bit dangerous, is that you don't know you have kidney disease until it's too late.
Absolutely, and that is why screening is so important.
All right, well, who is at most risk for kidney disease?
Individuals who have diabetes, hypertension, seniors over the age of 60 have risks of developing chronic kidney disease, and certain racial groups such as African Americans, Native Americans, they are in higher risk group categories and can get kidney disease just because of genetics.
How about family history? If my mother or father had kidney disease, or maybe a grandfather or grandmother, am I more susceptible to getting kidney disease?
Absolutely. You will be more susceptible to having kidney disease, and especially if you have one of those other risk factors such as diabetes, hypertension, and older men, urinary obstruction, etc.
So Dr. Qureshi, as a kidney doctor, nephrologist, how do you go about testing patients for kidney disease?
There are 3 or 4 essential tests that we need to do. First of all, anyone can perform blood pressure tests and making sure that the blood pressures are okay, because one of the symptoms of chronic kidney disease is high blood pressure. The second thing is we can do a urine test. In the urine, we can check for protein and blood. And blood and protein in the urine are signs and symptoms of chronic kidney disease. We can also check a blood test with serum creatinine. Creatinine is the test which tells us what is the function of the kidney. Other imaging tests such as ultrasound or CT scans can be done of the kidney to make sure there are no anatomical issues with the kidneys.
So someone has now been diagnosed with kidney disease. How do you go about treating it?
First of all, you have to find out what is the cause of the kidney disease, and therefore you can only treat the cause of the kidney disease. If a person has glomerulonephritis, which is inflammation of the kidney, there are certain medication that can be used to treat that particular disease. If some other diseases have caused the chronic kidney disease, such as diabetes, hypertension, other risk factors, which we just discussed about, then what we need to do is treat those. Such as if the blood pressure is high, we need to make sure it's below 140/80. If a person has diabetes, making sure that the glucose level are nicely controlled and their hemoglobin A1Cs are around 7. If they have been taking medication which have damaged the kidneys, then to make sure that they do not take those medication. Making sure their blood levels are okay. So if they have anemia, managing that, managing their cholesterol levels, managing their nutrition, making sure they're eating a balanced diet, and managing and keeping a healthy weight.
You know, some diseases can be cured. Is kidney disease one of those, or is kidney disease, once you've had it, you're not going to get rid of it?
It kind of is depressing to know that if you once usually have it, usually then you have it for life. Mm-hmm. The good thing about that is that you don't need 100% of your kidneys, like your eyes. For kidneys, if you have 25% kidney function and you make a commitment of keeping that 25% kidney function stable, then you may just do fine without having any symptoms of kidney disease.
And you keep that stable by managing those other conditions that you talked about, hypertension, diabetes, and such.
Absolutely.
Well, what about managing advanced kidney disease?
If the kidney disease continues to progress, and most people will lose 1% kidney function every year after the age of 40 to 50 years of age, then if they have chronic kidney disease plus they are aging, they may develop end-stage renal disease. And there are methods to treat end-stage renal disease. The best way to treat end-stage renal disease is by doing a kidney transplant. Unfortunately, Jason, there are 100,000 or 90,000 patients waiting for a kidney transplant every year, and only 15 to 17,000 of those 100,000 patients will actually get a kidney. So 85,000 patients will not get a kidney transplant. So the best treatment option is kidney transplant. After that, those patients who did not get a kidney transplant, we can do dialysis. There are 3 ways dialysis can be done. There are 2 ways home dialysis can be done. One is home peritoneal dialysis, where we put fluid in a person's belly and then it is taken out after it has been cleaning the blood. And then another method is by doing blood dialysis, which can be done at home. Then there is a method where a person has to go to the dialysis unit about 3 times per week. That is Monday, Wednesday, and Fridays, or Tuesday, Thursday, and Saturdays, 4 hours each time, and get their blood cleaned over there. The last method is doing medical renal management. That is doing everything medically to treat the kidney disease, such as managing diabetes, hypertension, anemia, by giving shots, by giving medications, just not doing transplant or dialysis.
So for people that don't know what dialysis is, what is it?
It's basically a method of cleaning the blood. There are 2 forms of dialysis, peritoneal dialysis and hemodialysis. In the hemodialysis form, which is very common in the US, not the best one, I would say. The peritoneal dialysis is as good and more convenient than hemodialysis, in which we put 2 needles in the veins of a person's arm. Through 1 needle, the blood goes out, goes into the machine, the filters clears it, and then the blood goes back into the patient when it is already cleaned up.
So essentially, it's a mechanical solution to replacing what the kidneys normally do.
Absolutely. And then giving medication, because kidneys do so much more than just filter.
Right. And back to the transplants, so few transplants. You said 100,000 patients need transplants, only 10 to 20% of those actually get that. Is that because finding a match for kidney donor is so difficult?
No, actually, Jason. The reason because kidneys are not available is because the need is more and the availability is less. What we can do to increase availability as individuals is we can look at our licenses, the driving licenses, and if you can mark and become an organ donor, then your kidneys, if God forbid something happens, can be used for someone who can come off dialysis if they get it.
Is there a misconception that to be a kidney donor, you have to be an immediate family member?
Actually, you do not have to be an immediate family members. There are 3 ways we get kidneys. One, as we talked about, the cadaveric donors. Something happens to someone and they die. They give their kidneys as the best gift of their life. And then the second way is to get a kidney from a loved one or a friend or a family member. And the survival of kidneys, either they come from your family members and they're a perfect match compared to a friend or an unknown person who's not a complete match, are very much similar. Not 100% similar, but many, many years, more than a decade.
Let's talk about kidney stones. I've heard a lot about kidney stones. I've never experienced them, thankfully. If you get kidney stones, does that mean that you have kidney disease?
If you have a kidney stone, that does not 100% means that you have chronic kidney disease. But if you have too many kidney stones, then you can develop chronic kidney disease. It is extremely painful, Jason, as we have been talking off the camera. Mm-hmm. It's very painful. Women can actually know how painful it is. They can have childbirth without anesthesia and they will find out how painful it is. And for men, we'll have to experience actually a kidney stone to find that out.
How common are kidney stones?
1 in 10 men and 1 in 20 women can have kidney stones. The good thing is we live in an area where kidney stones are not as common as many other parts of the world.
And what exactly are the stones? What are they?
The kidney stones are basically precipitated minerals, basically. Imagine that you have powdered milk, and instead of trying to dissolve a tablespoon of powdered milk in a glass of water, you're trying to dissolve a tablespoon of powdered milk in a tablespoon of water. It would not dissolve. When it would not dissolve, it would make precipitations, and that's how kidney stones form, and kidney stones are just those precipitations.
So how do you go about treating kidney stones, or is it just time?
Well, you drink plenty of fluids, and by fluid I mean not colas. Lemonade and water are the best friends to keep kidney stones away. Making sure that you do not eat too much animal protein. And for everyone, we should be eating less salt. Less salt intake, less protein intake, especially animal protein, having a balanced, healthy diet, and drinking plenty of fluids other than colas and tea.
Is that the same remedy for preventing kidney stones too, is to do those things?
Absolutely. Keeping yourself hydrated is a very important part to stay away from kidney stones.
Well, finally, are there things that people can do to keep their kidneys healthy and prevent kidney disease overall?
There are certain things that individuals can do. Making sure just remaining a healthy weight and a healthy lifestyle is very important. Getting your blood pressures checked. If they are high, getting them treated. If a person has diabetes, getting the diabetes treated nicely. And medication are very important too. Please take your medication as prescribed by your provider and do not take any non-essential medication, especially over-the-counter medications such as non-steroidal anti-inflammatory drugs taken over a long course of time can be very damaging to the kidneys. And making sure if you do smoke, please quit smoking, and those are the healthy things that you can do to avoid chronic kidney disease.
And I would say probably most of those things, if not all of them, are ways to just overall just being healthy, not just prevent kidney disease, but just to be healthy.
Absolutely. Just keeping a healthy lifestyle is very important. Keeping your cholesterol's good, blood pressure's good, healthy weight, exercising, very important.
Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Dr. Fawad Qureshi, Mayo Clinic Health System Interventional Nephrologist, for joining us today on Speaking of Health. Thank you, Dr. Qureshi.
Thank you, Jason.
Have a great day, everyone, and be healthy.